Yeah, we are live now. Good evening, esteemed faculty members and all the delegates. Thank you for joining. This is Sahiti on behalf of Shield Connect, welcoming you all for today's webinar, Human Milk Bank, the Divine Donation. And let me introduce the moderator of today's webinar, Dr. Dinesh Kumar sir. Sir is the consultant neonatologist, Rainbow Hospital, Chennai, and a lifetime member of NNF. Sir has 5 publications and 3 ongoing researches and 4 chapters in 2 books. Sir is the preterm care and neonatal screening in essentials of neonatology. Sir's areas of interest are neonatal infection diseases, neonatal procedures, and antenatal counseling. I welcome you, sir, and I hand the session to you to introduce the speaker.
Good afternoon.
Good afternoon, Dinesh.
It's audible?
Yeah, it's audible.
Yes, sir. It gives me immense pleasure to welcome you all today's webinar on Human Milk Bank, the Divine Donation, organized by A4 Hospital in association with the Foxy Society, Chennai. We are privileged to have with us today Dr. Srinivasan sir. His contribution to pediatrics and neonatology is so vast. So the single slide cannot do justice to his achievements, and his leadership and vision have transformed pediatric and neonatal care across Tamil Nadu and beyond. Rather than the formal introduction, I believe SA's work speaks for itself, and many of us here have already witnessed the tremendous impact he has made in our field. Your dedication and contribution to the field of pediatrics and neonatology are truly inspiring, sir. With great respect, I now invite Dr. Srinivasan sir to take over the session and share his insight with us. Over to you, sir.
Thank you.
Thank you.
Thank you, Dinesh. Thank you. Now, can you put the slides, ma?
So please give me a minute, sir. I'll wait.
Can you put the slides or? Yeah, good evening, all of you. I think I thank the Foxy and the A4 Hospital Limited for giving me the permission to talk to you for some time about the Human Milk Bank establishment, what Tamil Nadu has done so far. I think, am I audible? Am I audible?
Yes, sir. Yes, sir. You are audible, sir.
Yeah. So let me now go through what as we have done in the state of Tamil Nadu in Human Milk Bank. Of course, you know the components of Human Milk Bank. Number one is the mother should be motivated, number one. And there should be antenatal counseling to the mother to make her to donate milk. That is very important. Whether the baby is sick or whether the baby is normal, that is the point number one. Then you should have a wonderful sepsis-free collection center in the hospital, which should be located very near to the SNCU. Then after collecting, you have to store it in a pakka environment. Then you should do pasteurization and lot of processes. Then again, you have to put it in deep freezer, store it, and rule out, do the screening, no infection is there. Then you have to dispense the milk to the people. This is what we do in a Human Milk Bank. So can you go to the next slide? Yeah. So that's what I was telling about the Human Milk Bank. This collection is important, screening is important, process and stores and dispensers. Go to the next slide. Next slide, please. So let me go to the history of this Human Milk Bank. Previous slide. History of Human Milk Bank. Even though in 1909 it started in Vienna in Austria. Then after 10 years, every decade, then they started having in Boston, they started having in Brazil. In India, I think Mumbai is the first state or the town, city, which had a first Human Milk Bank in 1989. In fact, Chennai started having in 2014. Then after the initiation at the Institute of Child Health and Hospital for Children, our National Health Mission of the government of the Tamil Nadu, with the concurrence from the state government, we started putting lot of human milk banks in the form of CLMC, that is Comprehensive Lactation Management Centers, and LMU, that is called the Lactation Management Units. So what is the difference between CLMC and LMU? CLMC is the one, Comprehensive Lactation Management Units, is fully established in the medical colleges, where the microbiology department is available, where you can do the screening of this collected human milk and you can start using it also. Wherever you don't have the medical college, you don't have the microbiologist to assist you. In those situations, you can establish what is called LMU, that is lactation management. In LMU, where the mother's own milk is being used, MOM, where if the baby is really sick, you take the mother's milk, store it in the deep freezer, and when the baby is able to take, then you use the same mother's milk. That is what the principle of lactation management unit. In CLMC, it is the mother's own milk can be used at the same time. Donor milk also can be used for babies when the mother is not there or mother's milk is not available. So this is the model. What you can see in this picture in India, what we are practicing is that means all SNCUs, especially newborn care units or neonatal intensive care units, can have a human milk bank. But our government of India guidelines says that or any SNCU to develop, you should have minimum 300 deliveries to occur. When I want to establish a CLMC, Comprehensive Lactation Management Unit Center, then I should need mothers to donate the milk. That means average of 300 deliveries per month is the norms for the government of India guideline. And suppose you have 100 deliveries per month, then you can start using what is called LMU, Lactation Management Units. So this LMU or CLMC, whatever it is based on the delivery load, is being established in the state of Tamil Nadu. And this CLMC and LME is a part of the SNCU. It is not a different department. In fact, it is a part of the SNCU, where the CLMCs need around 350 square feet for the establishment, and the LMU needs around 160 square feet for the establishment. Since it is a part of the SNCU nurses are taking over this CLMC and the LMU, and they are managing it also, so that the SNCU babies can enjoy the benefit of this human milk banking. So this picture shows you that how you should counsel the mother, how it can be collected. Whatever you say, but our policy is to early initiation of breastfeeding. In the early initiation of breastfeeding in the government setup, now we strongly advocate what is called immediate Gangaru mother care. The immediate Gangaru mother care is called zero separation of the mother and the baby. So what we do, especially institution where the deliveries, 10 to 15 deliveries per day is happening in any institutes. Now we started using Gangaru mother care, IKMC, rather than using transport incubator. Because you know that some of the studies, WHO has done a study involving India, Maldives, Tanzania, and many African countries. They have done a study and found out the efficacy of the immediate KMC, so that it improves the milk secretion, it improves the bonding, it reduces the nosocomial infections. So many advantages are there. In fact, they have found that the baby who is getting delivered in labor ward, when they reach NICU, there is every chance of going for hypothermia in the 10 to 15 minutes of transfer from labor ward to NICU. This study has shown that there is no hypothermia reported when it is transported in IKMC. So that's why we in Tamil Nadu strongly started practicing IKMC wherever the delivery load was not much. When you want to do IKMC in the district hospitals or in any other institutions, only thing what you should do, knowing that it is going to be an IUGR baby or it's going to be an SGA baby or it's going to be a preterm baby, we should counsel with the family and the parents in such a way that we are going to transport your baby in immediate KMC to the NICU, not in transport incubator. Counseling has to be made to the parents. And I have found that the acceptance rate of these parents are 100% when I go and say that I'm going to transfer. Rather, I say simply in English, better to transport the babies in a emotion-full mother rather than emotionless equipment. That's what I used to say to all my NICUs. How most of the NICUs started doing an IKMC. So it improves the breastfeeding. It gives one of the good lactation support. So this picture shows you that, yes, you are going to practice IKMC and KMC, for it's one of the excellent support for lactation. And otherwise, if the baby is really sick, now we have a policy of getting the colostrum from the mother and putting the baby either in the NG tube or smearing the colostrum over the lips of the baby. And we all know that the advantage of colostrum, that it prevents ventilator-associated pneumonia, it prevents retinopathy of prematurity, it prevents bronchopulmonary dysplasia. So many advantages are there. So we started aggressively doing this. So in this context, what I want to emphasize that the high time that this colostrum, the first 3-day milk of the mother, should not be wasted at any point of time. Whether the baby is alive or the baby is very sick, whatever it is, as long as the gut of the baby is all right, I think you can start doing a colostrum given to the babies also. So this IKMC and colostrum feeding in the first 3 days is going to be the game changer, which is going to establish a very good lactations for the mother also. So next slide, please. Next slide. Yeah. So what are all the prerequisites? I was just talking about what are the things you needed. When I say 300 deliveries in a hospital is happening, means that you can have a 15 to 20 bedded SNCU where you can have a 350 square feet milk bank. Similarly, for LMC, it is 160 square feet where you are going to have only deep freezers and refrigerator. There is nothing called, you don't have an automatic pasteurization unit. So you need not have all these units. You can have a freezer and this one, and just as soon as the baby is able to take the milk, the same mother's milk which has been stored in the freezer can be taken and used for those babies also. Next slide. Next slide, please. Yeah. So what are all the human resources? There are this government of guidelines. I say so many people should be there for establishing the human milk bank. But countries like our India and Tamil Nadu, it's not possible to have all these people. Like 2 neonatologists, a bar pediatrician, yes, they are available. But in many of my government centers, I don't have any CLMC technician, I don't have any CLMC manager. Lactation support staff are nothing but our NICU nurses. Of course, we have microbiologists and other helps is not there. So best time is the NICU should take over the CLMC or LMU in their control, so that the nurses who are working in the SNCU or working in the NICU can be utilized for taking care of the CLMC and the LMU also. Next slide, please. Next slide. So how to set up a human milk bank? This is very important. I am just putting this 350 square feet, how you can divide. How most of my government institutions has got milk bank like this. So initially there will be a reception come administrative area will be there. That is the area. Then we have a counseling room where the nurses and the doctors will sit with the mothers and will talk to the mothers about the importance of breastfeeding, importance of the breast milk. And we are explaining to the mother that the baby is sick, about this milk is very important for the excellent outcome. All these counselings are done, and so that the mothers can start giving the milk. In fact, what is happening in some of the institutions every day is around 20 to 25 mothers are voluntarily coming to the human milk bank and donating the milk. When I talk about this donation, I should mention one person who is in Coimbatore. Her name is called Rupa, an engineer. She has got a NGO called Amrudam. This Amrudam, this Rupa has got so many Facebook friends that she is collecting this milk, human milk, in a sachet and keep it in the deep freezer and supplies to the government institution by liters and liters and liters. In fact, they have done a lot of Guinness record in collecting the human milk and donating to the government institutions. At present, this NGO is covering almost 13 to 14 districts in the state of Tamil Nadu. So this counseling is very, very, very important. Then, of course, you have a room called milk expression area. That is the area you should be really calm, very comfortable to the mother. And also we used to put some music system there so that the mother can enjoy the music and let her be in a good mood frame of mind to donate more milk. You all know that the stress which is to be there in the mother is going to be the biggest obstacle for oxytocin and prolactin to secrete. So whatever way you want to alleviate the stress in the mother, either in the antenatal period or in the postnatal period, that will be beneficial for the secretion of milk. And of course, you should have a refrigerator for storage of raw breast milk. Then you can have a deep freezer. We have two deep freezers. I will explain to you why we are having 2 deep freezers. And of course, we'll be attached to a microbiological laboratory to send the specimen to do the culture and find out how we can use it also. Next slide, please. Next slide, please. Yeah, so this is what how we can go around. The donor is counsel, then you collect milk, and after collecting the milk, you have to put it in the freezer, stay a deep freezer. Then you should do pre-pasteurization screening, then put it in the do the automatic pasteurization. Then you get post-pasteurization screening. Post-pasteurization screening milk and pre-pasteurization will be stored in two different freezers. Once the results come that it is very fine, then you can start use it. If the results show some contamination, then you cannot use it. So this picture shows how we are going to follow in a milk bank. So next slide. Yeah, next slide, please. Next slide. Next slide. Next slide, please. Yeah. So important. Always, whenever the mothers comes, you should do a good counseling and stimulate the mother that she is willing for more than willing to donate breast milk. Number one. Then you should have a consent form also from the written consent form from the donor that I am not pressurized. I am not compelled to give milk. It's voluntarily with my all medicine. I am giving something like that. Then we have to do some serological test also to use the milk for consumption babies. Next slide, please. Next slide. Okay. So what about the temporary disqualification? Who are all the mothers where you cannot take the breast milk for a donation? Number one is any acute infection. Any mother who has got an high-grade fever, any acute infection, she's in the state of some fever, acute febrile illness, we don't collect breast milk during that period. And any mother who has got cough which is persisting for more than 2 weeks, thinking that she may have tuberculosis or not, so we are not collecting it. And any mother is having a mastitis or any fungal infections in the nipple and the areola, or any mother is having herpes zoster of the breast and thorax. And more importantly, you should ask about the immunization also, vaccination. Maybe a mother may not have a MMR, but she would have gotten rubella vaccination also. If the vaccination has been given in the past 1 month, or she had a varicella vaccination in the past 3 months, or she had varicella itself in the past 1 month. These are all the criteria. So we don't collect milk in those mothers. So vaccination is very important, whether it has been given 1 month prior or 3 months prior, whether mother had chickenpox or not, whether mother had a rubella vaccination or not, or any herpes zoster, or of course any acute infection and chronic cough we don't do. Next slide, please. Next slide. And other parameters for not getting the human milk is number one is blood transfusion. Any mother who had a blood transfusion in the last 12 months also, we don't agree. Organ transplantation, these are all the Government of India guidelines. It is not that I or who decide. The Government of India has started with the expert committee, forming an expert committee, and they given the guideline like this, that these are all the mothers, you need not collect human milk. Organ transplantation, which has occurred within 1 year, the last 1 year period. The mother is HIV positive or HBsAg positive or any venereal disease or any sexually transmitted disease, I think you are not supposed to collect. Very uncommon scenario, but still very uncommon scenario, but still I think some I think somebody can mute it. Yeah. Any uncommon situations like those who have previous slide, please. Previous slide, please. Yeah. Alcohol and next one. Yeah. Alcohol and tobacco addictions, we say it is not very common, but still we find some of them has got this tobacco addiction and other things are there. And any mother who is on malignant therapy or leukemia or lymphoma. So these are all the situations we don't collect the human milk from these mothers. Next slide, please. So how to do a milk expression? Of course, this is not happening in the milk bank because we have got a very good modern expression milk. This one machines are there. So need not worry about this, but still it's mandatory to teach the mothers how to do milk expression. How to do a hand washing, how to keep my personal hygiene in a clear manner, how she can prepare, how you can express the milk by putting your thumb finger and index fingers up and above over the areola. Initially, the movement should be to go backwards towards the chest. Then you start doing a massaging so that the milk will start flowing. So these are all the things what we do for those who don't have or who don't, there's no chance of breast pumps not available. But of course, in the government setup, we provide breast pump to all these mothers. So it is very easy that each and every milk bank can have around 2 to 3 or 4 breast pumps, maybe mechanical, maybe electrical, or maybe even non-electrical also. This milk, they are the different range also. Some breast pumps are available for 30,000, some are available for 1 lakh also. Through Tamil Nadu Medical Service Corporation, TNMSC, we are able to procure. And for your information, that Tamil Nadu at present we have got 20 comprehensive lactation management centers in 20 medical colleges and 25 lactation management units in the district hospitals and other medical colleges. Overall, it is almost 45 human milk bank is available in the state of Tamil Nadu. The whole of India, you take maybe around 120 or 130. So Tamil Nadu is the one state in the country which has got more number of comprehensive lactation management centers and the LMU also. Next slide, please. Next slide. So this is what I was telling, how to do a manual expression of the breast to have a milk secretions. At present, in the government setup, on a hospital setup, it is not that much needed. Maybe we are going to use the breast pump. Next slide, please. Next slide. Yeah. So these are all the electric breast pumps. Many companies are available that you can use for expressing the milk. Usually it takes around 30 to 40 minutes to get most of the milk is getting out. How to do also is very important. Sometimes you have a double pumping machines are there or single pumping machines are there. But always you wait for, you do expression for 10 to 15 minutes so that the milk flow will be really good. Once the milk slows down, you wait for 30 to 60 seconds, then you can take out this one. And stop pumping after 20 to 40 minutes or when the milk stops flowing also. So these are available for 30,000 to 1 lakh range. It is available in the Tamil Nadu Medical Service Corporation. Good companies also. You can use all these breast pumps. We use mostly the electrical breast pumps in most of the government institutions. And some of them can have a manual breast pumps also in a small Taluk hospital or district hospitals. Next slide. Next slide, please. So this is the most important step we should do. Previously, we used to have the shaker water bath and other thing with the microprocessor to do pasteurization. Pasteurization usually is done by 2 methods. One method is called the Holder method. It's a older method. And it's, as the name says, the older method for us because if you do it in 62.5 degrees centigrade for 30 minutes. Now we have procured automatic pasteurization machine in most of the comprehensive lactation management centers where we follow what is called HTST method. This HTST method is nothing but high temperature, short time method. That means pasteurization is done at 72 degrees for 16 seconds. That is more than enough to do the pasteurization. The idea of pasteurization is to destroy the microbes which is present in the donated milk so that it can be utilized very well. That's why I always say that to know whether the microorganism present or not, there are 2 ways of doing the testing. Some of the good centers, what they do a pre-pasteurization microbiological culture and they do the post-pasteurization microbiological culture also. Let me show it in the next slide. Go to the next slide. Next slide. Yeah. So always the containers are very important. Very important is when you collect the milk from each and every mother, that container name should be there, label should be there, it should be tightly closed, and you should always maintain separate identity for each and every mother. And this containing milk, once you know it is contaminated, then the milk has to be discarded. So as soon as you collect in a separate container for each and every mother, you have to put it in the fridge or then a deep freezer. But before that, a sample can be sent for culture, bacteriological culture also. Next slide, please. Next slide. Yeah. See, this is what pre-pasteurization testing of DHM. That is, DHM is donated human milk. So if you do a pre-pasteurization testing of these milk, and if you found that the most common organism sometimes you come across is Staphylococcus aureus, if the colony count is more than 10 power 4, then you should discard the milk. You are not supposed to use. Other small microbes, some are accepted because it may be killed during the pasteurization. That's why it's called pre-pasteurization testing. There's one thing called post-pasteurization testing also. Here, what do you do after doing the pasteurization? From each and every batch, you take a alicota of milk and send it for the culture. The rest of the batch should be stored in the deep freezer. Wait for the culture report to come. The pasteurized milk that has a total viable microbial count of 10 colony forming units per ml or more, then discard it. Otherwise, you can do it. But generally, what happens because of the economic other thing reasons and other reasons, many centers are not doing pre-pasteurization testing and post-pasteurization testing. Generally, some of the centers they do only the post-pasteurization screening, and if they found that the microbes are not there, then they can use those milk for the babies. Next slide, please. Next slide. So once you do, these are all the deep freezers. The deep freezers are available plenty in the government because we are the strongest partner in the government setup. We do around 85% immunization throughout the state. That means each and every small hospital also has got a deep freezer, 1 or 2. And we always have a 2 deep freezer. 1 deep freezer is the collection of pre-pasteurization milk. The other should be the post-pasteurization, so that according to the organisms present or not, you can use it or discard it. Next slide, please. Next slide. I think the same slide. You can go to the next one. Get next one. Next slide. Next one, please. Yeah. Now, how this milk, and this is a common questions many people they ask. No? So when I do in the deep freezer, at what temperature you are going to keep the milk? I always keep the milk, say, minus 20 degrees Celsius in the deep freezer. And you have to wait for the post-pasteurization report. The report says negative, then you can start using it. That's why I say any milk bank you want to start, always try to have 2 deep freezer, not 1 deep freezer. One for the pre-pasteurization and another for the post-pasteurization. That is very important. So for normal people to understand how these mothers, suppose many office-going mothers are there, they feed their babies and they come in the evening. So there's a lot of questions whether I can start feeding my baby, whether I express my breast milk and keep it and give it to the baby. Yes. So as long as the room temperature is less than 25 or equal to 25 degrees centigrade, any collected milk from the mother morning, say 8 a.m. can be kept up to 2 p.m. That is up to 6 hours you can keep and give that also. Suppose if you want to keep it in the refrigerator, then you can keep it for 24 hours. The best thing is when you want to give to the baby, you take out from the refrigerator and put it in a small warm water so that the chillness maybe go on, the cool will be go, the temperature will slightly go. Once it becomes not that much chill, then you can start feeding them. Suppose I'm putting in the freezer. So again, I put here is unpasteurized milk and pasteurized milk. When I put the unpasteurized milk, that means this 3 months can be the time they can be used. And pasteurized milk, you can keep it there in the freezer. And the pasteurized milk means you can keep it for 6 months also. Then you can use the milk even up to 6 months. So if it is the refrigerator, it is for 24 hours. In the open area, it is around 4 to 6 hours. And if you keep it in the deep freezer, you can go up to 6 months also. Next slide, please. Next slide. So these are all the equipments available. Now, once you get the report that there is no bacteria or nothing is available, nothing is there, you can start using the milk. Then what you should do, take out the milk from the the deep freezer and start doing thawing. So this thawing is nothing but you bringing back to the room temperature of this milk rather than which is almost freezed milk. No? So generally we do thawing by putting in a warm water for some time. Once it is ready for feeding, then you can start feeding. Most important point in thawing is once you take out the milk from the deep freezer and start doing thawing and start utilizing for the baby, you cannot put it back, the milk which is not being utilized or after doing thawing back to the freezer. That should be discarded. So the milk cannot go back to the deep. That is the most important point you should think. You are taking milk from the freezer, do the thawing, give to the baby. Suppose you do the thawing, you are not able to give to the baby, that milk cannot go back to the freezer. Once you take it out, it's one-way traffic only. You cannot go back to the deep freezer. Next slide, please. Next slide. So that's what I'm telling about this thawing. So this is very important, should never be refrozen. That is the most important point. Thawed milk should never be refrozen. You cannot go back to the deep freezer once you take out. Right. Next slide. Next slide, sir. Yeah. Then, of course, the dispersion of human milk. This is very, very important. Okay. Who are all the babies who require? Okay. See, a lot of studies have shown that. Is there any difference between human donated milk and the mother's own milk? So, some of the babies have been given mother's own milk. Some of the babies have been given donated mother's milk. Is there any difference? By physical growth, say height, weight, or whatever it is, there's not much difference. So both the babies are growing well. Some of the studies they have done up to 18 months have seen that the growth of the babies who had mother's own milk or those of the babies who had donated human milk, they did not show any difference in the weight or height or head circumference or whatever it is. But some of the studies shows that the IQ of these babies when it is attached to the later period, that is better in a mother's own milk babies rather than a human milk bank milk given to the mother. That means who are all the babies who can get real benefit because of this human milk bank? Suppose the baby is sick, the mother is donating the milk. These are the babies should be taken care by the mother's own milk only, MOM. This mother's own milk, even though the baby is sick, whether the maintain with the previous slide, even though the baby is sick, whether we can feed the mother's milk through the nasogastric tube or oropharyngeal tube if there is a problem in the gastric area, or if the bowel sounds are not good, whether I can smear the milk, something like that we should do. Or this milk can be stored. That's why I said in the beginning that if you are using the same mother's milk, there is no need to do for any screening of bacteria or nothing. That's why wherever there is no microbiology department, you establish LMU. That is just same mother's milk, store it and use it for the same baby. Suppose if you want to give, some mothers are not there, some maternal death has happened, and this baby needs, that is the time we use the human milk bank, other mother's milk to the baby also. That can be done. So that means those are the babies where the mother is not available, where there is a maternal death has happened, or the abandoned babies, very sick babies. All these babies are definitely benefiting because of this human milk bank. But our ultimate idea is each and every baby should have their own mother's own milk rather than for human milk bank, this one. So how to get this secretion of human milk? See, you may be asking a lot of questions that the mother was in such a stressed period where the baby got admitted and is very sick. The mother feels psychologically depressed, whether she can donate milk, whether there will be secretion. So in ICH, what we have done, whether how to improve the milk secretion for these mothers. So what we have found in our study done by Dr. Swapna, now she is a DM resident in Nilofer Hospital, Hyderabad. She is the person who had done the study and I was part of the study. What we did in the postnatal period, we gave around 120 gram of nutritional powder, that is 720 gram of nutritional powder for 1 week. We gave to the mother in the postnatal period when the baby is sick. We gave this in the form of, say, some different preparations we gave to the mother. And that DMPG was just finding out how it is going to improve after some time. But to our surprise, what we have found that these mothers, when they are about to secrete, say 100 to 110 ml, after the impact of this nutrition, we have found that their milk secretion has increased to 180 ml. That is one of the positive steps what we have seen in the study, whether the postnatal nutrition. So you all know in government program, all the postnatal mothers are entitled to get 720 gram of nutritional powder per week from Monday to Saturday. So we started using that scheme. Instead of going to the village, we get it from the ICDS, those nutrition powder to ICH. We start giving to all these mothers, and the study showed that there is an absolute increase in milk secretions in the mother whenever we give adequate nutritional support. So idea, many people may think that human milk bank is a fashionable one, but what I feel now, that is a game changer, that is a need of the hour in each and every hospitals, where you expect mother, even though the guideline says that 300 deliveries should be there for establishing the human milk bank. The pediatrician and the obstetrician are able to convince each and every mother to donate milk, then these guidelines need not be there. You can establish a human milk bank with the 360 square feet, with good automatic pasteurization. You can have 2 deep freezer, 1 fridge, lot of milk containers, and dedicated staffs. That is more than enough for establishing the human milk bank. In our government setup, I think we have almost for every unit, we are spending around for purchasing refrigerator, then milk bottle sealers, stainless steel wire mesh basket, and other things. What we are spending around 2,29,500 rupees for all these small things. Of course, the automatic pasteurization and the milk breast pumps are all procured by the TNMSA, which may come around, say, around 10 to 15 lakhs for the government to do an expenditure. So we do all these things in the government setup, and at present our government is running very successfully. What I have seen from each and every SNCU that around 15 to 20 mothers are donating milk each and every day in yield all the NICUs. We do collect around 1.5 to 2 liters of milk every day, and 15 to 20 babies in the NICUs are getting benefits because of this collection of this human milk bank. So our mortality also has come down drastically. Now we have out of 1,30,000 babies getting admitted in our NICU the past 1 year. Our death is around 5,000 to 6,000 baby, which comes around 5.2% of the total admission, which is very good. In fact, which has brought down the neonatal mortality rate of Tamil Nadu is now 8 per 1,000, and the infant mortality rate is 11 per 1,000. So this human milk bank is the game changer. So whenever we thought of human milk bank, the 4 components you are not supposed to forget is antepartum counseling rather than the postpartum counseling. Point number 1. Point number 2, zero separation of the mother and baby, giving immediate Gangaru mother care to the baby within 30 minutes. In fact, we mobilize the baby in Gangaru mother care position from the nursery to the from the labor ward to the nursery. If the mother is not available, very sick, we use grandmother, we use relatives, we convince them, we counsel them, and do that also. Continue KMC even in the ward, even though the baby is sick. Now KMC can be given even if the baby is in ventilator or CPAP. These are all the good practices which is going to definitely improve the lactation outcome. And of course, adding human milk bank definitely will save many babies. So this is a success story of human milk bank. I think any questions I can answer. And thanks for the opportunity for giving this lecture. Thank you very much.
Thank you very much
Dinesh,
for your insightful and thought-provoking session. Today's talk has given us valuable knowledge to take forward in our practice. I
Yes,
also
sir.
thank all the participants for active engagement and engagement. And this is open for questions. And you can type your questions in the chat box also. And sir, I have a question, sir. And what
Yeah.
about the commercially available human milk, sir? It is still available.
See, as per the IMF Act, milk is not for sale. That is the basic
Yes, sir.
denominator.
Yes, sir.
Generally, we don't discourage. In fact, some of the companies like Neolet or somebody, when they were approaching me that, sir, what we can do, there already a case is pending in the court, whether this can be done or not. My advice to those people that you cannot sell the milk, but you can charge for processing, making preparation, processing, packing. Those things you can do to distribute to the milk, distribute to the people, rather than charging them. That is the biggest mistake these companies are making. I think they should counter argue with the Supreme Court that I am giving milk free, because they collect milk from the mother saying that this is for sick babies. At the time they are not supposed to sell it also. In fact, as per the IMF Act, even in our National Neonatology Forum conferences, we are not encouraging these companies, even though they are willing to donate more for the conferences, which still we are not doing. So the commercial available preparation, I think it's a long way to go, like country like India, where these are the things these people should sit and discuss. Suppose if they give milk freely and charge very little for the processing and packing, then we can think of using it for the benefit of the babies, rather than now supporting and promoting the commercial milk is not correct now.
Yes, sir. Thank you, sir. We have few questions in chat box, sir. Do you need to screen the mother for any disease?
No, this all go by, see, especially in the private setup, you can do because you may be encouraging, you can spend a lot of time with the mother, but in the government setup, the time spent is very little. So generally, we go by the symptoms. If the mother is more than 2 weeks cough, the mother has got a chronic debilitating illness in the form of, say, leukemia, lymphoma, something like that. So these are the mothers we don't encourage. Of course, whatever the milk we are going to take, we are going to do a pre-pasteurization screening and post-pasteurization screening, see whether the milk is infected or not. Then you can discard also. So we cannot go very strictly. In fact, our obstetrician already they are screening the mothers when they come for delivery. So our job is easy. Most of the mothers are seen by the obstetricians and they always screen completely about this HPS, AG, HIV, everything they do in the antepartum period and diabetes, everything they do. So our work is very little. So as long as we don't have any big illness in the mother, I think the pre-pasteurization screening and post-pasteurization is good enough to screen the milk. And any mother who wants willing to donate the milk, I cannot stop also. I cannot stop ethically. If the mother wants to give the milk, donate. Our job is to give the good, pure, sterile milk to the babies. That's it.
Yes, sir. Thank you, sir. The next question is it possible to get to see the study that was conducted with the nutritional powder?
I think I don't have. I think you must be a good friend to Swapna, Dinesh.
Yes,
You
sir.
must be knowing about Swapna. I think you can get it from her. Because
Fine.
why I know, even though I was not part of the newborn team, I'm very close to the government. I was in the higher position in government. She requested me to get the powders from the ICDS department, the social welfare department. And I wrote to the social welfare department and they readily agreed for that for the study also. And she has proved that around 60 to 70 ml milk increase after the post-nutritional this one. So the general message is, let us not see, this well understood by anybody that in the postnatal period, the nutrition plays an important role and the mind plays an important role. The mother is without any stress, without any anxiety, without any anger. The prolactin and oxytocin are going to have a happy hypothalamus. I used to say happy hypothalamus in the mother. I think the prolactin and oxytocin is going to secrete, the milk secretion will be there. So our idea is to keep the mother happy even in the postnatal period, encourage the mother, counsel the mother even the baby is sick so that she can feed the baby, she can donate the milk so that we can use it also.
Yes, sir. So we also have witnessed that one. So motivation, counseling, and the nutrition part also plays a major
Correct.
role to get more milk from the mother. Yes, sir.
Exactly. See, why we are celebrating Seemandam? Why you are celebrating Puchuttul in the antepartum period? To make the mother and fetus happy. So these are all the cultures our country is doing for so many years, that the Seemandam, the Puchuttul, sending the mothers to the mother's house so that the mother will be completely happy, keeping the mother in the mother's house for first 3 months or 4 months. These are all indirect evidence for good mindset on the mother and for increased milk secretions. This say old practices, still some people say old practices, but still I advise patients, yes, these are all the practices should be there. Make the mother happy, make the hypothalamus happy. So you have a good secretion of oxytocin and prolactin, good milk secretions will be there. And of course, now I am very strongly and aggressively practicing IKMC. That is the game changer now. So we do that in many district hospitals. I am now influencing the medical college people also to do it. Any babies below 1.8 kg, I want them. In fact, Dinesh, I have stopped procuring 50 transport incubator in the government system. I just put out the file, don't buy transport incubator, let the baby be transported in IKMC. That's what I have done. So.
The next question is, can you share the regulations for the setting up milk bank?
Yeah, that I can, Dinesh, I can get it from some medical college and give you. If you go to the National Health Mission website,
yes, sir.
NHM website, you put it like setting up of a human milk bank, everything comes there. The Government of India guideline is very clear there.
Yes, sir.
So they can download it from the website itself.
Yes, sir. Yes, sir. postpartum mothers up to how many months postpartum are accepted for milk donation?
See, generally, our aim of giving milk donation is for our SNCU babies, which are staying there. Suppose the SNCU baby is going to stay 15 days, then the mother is going to be out and baby is going to be out. Suppose I have an 800-gram baby, stays in the SNCU for 60 days, 70 days, still I accept milk. See, there's no question of yardstick that after this date you don't accept, not like that. As long as the mother is free from infection, as long as she is willing to donate, you can donate. For example, I tell you, the Ruba, I was telling that NGO, they are collecting milk. That girl is got 2.5-year-old child. Still she is donating. That engineer. So there is no month or years to donate. Anybody can donate at any point of time. Our idea is to give a sterile milk to the baby. That's all.
Yes, sir. How much amount of milk per day a mother can donate? How much
Yes,
amount of milk? Yes, sir.
donate, yeah, it depends upon the mother also. Somebody can donate, go up to 300, 400 ml per day also. And some depressed mother go for 100 to 150 ml. We have seen mothers giving up to 300 to 400 ml of milk donation has also happened. That can be done.
Yes, sir. Is there any rise in incidence of breast milk jaundice?
That we have not done any studies so far because we have not done so far. I think this breast milk jaundice is a old diagnosis we used to get even for many years, not maybe connected to the milk bank or something. It's going to be breast milk jaundice. That's all. We have not done anything about it.
Yes, sir. Yes, sir. Mothers who got chicken pox from when the mother can feed or donate milk after recovery.
Yeah, I have given that those mother who had chicken pox for 3 months they are not supposed to give. That's what I have given in my initial slide. And those mother who had chicken pox vaccination, 1 month is the gap to donate the milk.
Yes.
Otherwise, we feel there may be a excretion of virus in the milk, which we don't do the viral isolation. We do only bacterial isolation and culture. So we don't encourage all this chicken pox. So any mother, similar, not only chicken pox, it applies to MMR or rubella also. It applies both rubella, chicken pox are all in the same category. If there is a disease, wait for 3 months. If there is a vaccination, wait for 1 month.
Yes, sir. Do you give oxytocin to mothers prior to donation?
No. We don't go for any those kind of. We are not doing any intervention except counseling and making the mother happy to donate. Not any other interventions we do for this purpose.
Yes. I think we don't have any other questions in chat box, sir. And
A lot of good questions.
yes, sir. Yes, sir. Very nice questions. Yes, sir. So thank you so much for sir, and thank you so much for the participants also for active engagement. And on behalf of A4 Hospital, we sincerely appreciate your time and presence, sir. We hope this session was enriching and look forward to having you join us in the future programs. With that, we conclude today's webinar. Wishing you all the pleasant evening. Thank you so much, and thank you so much for
Thank
the
you,
opportunity.
Dinesh.
Thank you, sir.
Thank you, Dinesh. Thank you, Foxy. Thank you, A4 Hospital also. Thank you.
Thank you so much, sir. Thank you.
Aruna ma'am, ma'am has told to display this slide, sir. Aruna ma'am. We can close the session, sir. Thank you.
Thank you, Ma. Thank you.
So we welcome you all for this upcoming webinar, which is on 30th and 31st August. So I hope everyone joins this meeting. Thank you.